What if the most important moments of your birth weren't fully explained to you?
What if how the system really works could change your outcome?
Well, you've come to the right place. Welcome to season 4 of the Birth Squad podcast.
We're Dr. Ijalma Bello and Dr. Kamisha Thomas. We are two OBGYNs with over 20 years of combined experience, and this season, we're bringing you all the way inside of the delivery room.
In the past, we've amplified the voices of birth warriors.
But now this season, we're adding something different. Our unfiltered perspective as physicians who have seen it all.
We're pulling back the curtain on labor and delivery, the real decisions, the real dynamics, and what actually impacts your outcome.
This is your blueprint.
Welcome to season 4 of the Birth Squad. Well, welcome back to another episode of the Birth Squad podcast. Today, we're going to be talking about a different topic. So we're talking about postpartum. We want to paint a picture or, set the scene for you before we start kind of diving into the topic. So you've had your baby, right? Everybody's celebrating. You've been discharged. You go home. And then suddenly it's quiet, right? And maybe that quiet is for the good or for the bad, right? There's no nurses checking in on you. There's no monitors. There's no hospital staff walking into the room. It's just you, your partner, and this baby that you're supposedly supposed to know how to keep alive and who needs you every few hours but can't communicate what it wants or needs. And for a lot of women, that moment, the reality really hits like, wait, what am I doing? Like, what now? Because the truth is, most people prepare you for labor. There's so much literature and so many resources that are focused on labor and delivery, right? You take the birth class, you pack the hospital bag, you install the car seat, you research all the different strollers, but the reality is very few people are truly prepared for what happens after birth. And honestly, that's one of the biggest gaps in women's healthcare because postpartum is not just recovery from birth, right? It's recovery while simultaneously learning how to care for this new human being that needs you for everything.
Yeah, so let's start and talk honestly about what the first few weeks actually feel like, right? So your body is recovering, whether you had a vaginal or a C-section or a complicated delivery, or maybe you just had a delivery that was like really smooth, right? But at the end of the day, regardless of the mode of delivery, you are having postpartum bleeding. That's part of it. You're sore. You may be swollen, especially a week later after delivery. I always tell people those legs can start getting very swollen. Your hormones are shifting very rapidly. Not only that, you're sleep deprived. Your breast may hurt, the nipples especially. You may be trying to breastfeed while also wondering if your baby is actually getting enough milk, right? And meanwhile, people are texting you, how's motherhood? Enjoy every moment. Isn't this the happiest time of your life? And sometimes really you're just kind of sitting there thinking, I love my baby, but why do I feel like I'm barely holding it together? And that experience is a far more common than people actually realize.
Yeah, I think it's just such a huge change in what is normal, right? It's your new normal. It's a change in your identity. So I want to think about a hypothetical example to kind of help you understand that or to clarify that, right? And this is an example that we see all the time. We have patients who maybe you're 2 weeks postpartum after like a C-section and you're waking up every few hours overnight. You're trying to breastfeed. You haven't had maybe more than like 90 minutes of uninterrupted sleep, but physically you're in pain, right? Your incision hurts when you move, you laugh, you stand up too quickly. You also feel pressure to like do the things that you were doing before because maybe you were the workhorse in the family. You were responsible for all these things like keeping the house clean and answering messages and entertaining visitors and looking put together because everybody talks about bouncing back after a baby. And because of that pressure to return to normal life quickly, this is putting pressure on yourself. And that pressure a lot of times comes from social media, right? We love it, we hate it, but it's showing us like footage and images of women smiling with matching pajamas and beautifully styled newborn photos. And you're like wondering, like, why does everybody else seem to have it better than me? How come they're more put together? How come they're handling it better? And comparison can be so incredibly damaging and dangerous because that story, the For You page does not show the crying, the anxiety, the relationship strain, the physical pain, the identity shift, the exhaustion. The list goes on and on and on. But we see it in our office every single day because we know the truth. So I think it's so important for everybody listening to remember that postpartum is not a performance. It is a major medical, emotional, hormonal, and life transition. And you should give yourself time to feel that.
Absolutely. And one thing that we really want women to understand too is that postpartum recovery is not going to happen in a week. Okay. Your body has undergone a enormous physiological change. Your uterus is working on squeezing back down to its normal size. Your hormones are shifting rapidly throughout your body. The volume, the blood volume that's in your body is actually changing too, right? And your tissues are healing. And so even after even having an uncomplicated vaginal delivery, there's many women who experience cramping, pelvic floor soreness, hemorrhoids, okay, urinary leaking, constipation that really hurts. And then painful intercourse later on is also quite common, vaginal dryness, fatigue. And then if you had a C-section, you are recovering from a major abdominal surgery. Yes, it's the most common surgery that we have and it's normalized, but it is still surgery. And you're recovering while also trying to take care of a new baby. This is tremendously a lot of demand on your body. And so many women might feel actually guilty for resting. And culturally, we often praise like the woman for doing it all immediately postpartum, for looking like she has it all together. But rather than like going around and supporting her and fostering that healing. Let me say this, healing is not laziness, rest is not weakness, and recovery is healthcare.
Absolutely. Another thing we really want to make sure we're talking about is what is normal and what's not normal. I think a lot of women are told, oh, that's just like postpartum, right? But sometimes the symptoms that are being dismissed are actually warning signs. So we want to take a moment to really provide you with that information so you know when to get support. And some things can be normal, right? So the things that are normal that we want you to be aware of are vaginal bleeding that gradually decreases. So most women are going to say that they're bleeding kind of consistently for at least the first 2 weeks. And then after that, everybody looks a little bit different. But by the time you get to that 6-week postpartum appointment, most women will say that their bleeding has decreased completely. Some will have a little bit of spotting and bleeding, maybe up to 8 weeks, but for the most part, by the 6-week mark, it's gone. And the other thing that is really common is cramping while breastfeeding. Now, why is that? Whenever you stimulate your nipple, your body releases oxytocin, which is the normal version of the synthetic version of Pitocin, right? And both of those hormones' jobs is to get that uterus to contract. And it's because your body thinks it's doing you a favor. It's like, don't you want to stop bleeding? Well, I got to shrink back down to the normal size. And the way I do that is when I'm stimulated, it's a call and response. So cramping while breastfeeding, completely normal. And I tell people if it's super painful, you could do a little pre-medication before. Usually you're going home with Tylenol or Motrin. You can take that if you know you're about to breastfeed, maybe the 20, 30 minutes before. And that's completely safe to do while you are breastfeeding. The other thing that's really common is the baby blues, which is emotional ups and downs that we see in the first 7 to 14 days, right? After delivery. So if you just start crying and you have no idea why, no, you're not alone, right? And that these are some feelings that people commonly feel in response to a loss of those high hormone levels that you were exposed to when you were pregnant. Another one is swelling, right? I've had people tell me it hurt to walk. The swelling was that bad. So it's because when we deliver, we have big fluid shifts and your body does something we call third spacing, meaning that fluid feels the tissue and that is painful to the touch. So what I often recommend is elevation, right? And compression. So if you have compression socks, go ahead and put those on. If you don't, go ahead and elevate your legs to see if we can minimize that swelling. And then the last one is fatigue. I don't got a great answer for that one, but fatigue is very common because you are constantly being woken up and you're feeding and changing the baby at regular intervals. So you're going to be tired and that's completely normal. But it's important for us to discuss what's not, right? So I always tell people, I want you to tell me if you are soaking pads every 30 minutes and that's going on for at least an hour, right? Sometimes we will pass a big blood clot. And there's two theories for that. Number one is that's your body's finally clamped down all the way and you pass that last bit of blood that was in the uterus. Another theory is that where that placenta was attached created a scar and you passed that scar. But that's like an isolated clot. But if you are actually soaking pads, you should come into the emergency room to be evaluated because we need to figure out what's going on. Okay. Another one is a severe headache that doesn't go away with medicine, right? Some people will be diagnosed with postpartum preeclampsia. So, preeclampsia, high blood pressure in pregnancy and immediately postpartum that can cause end organ damage. So, if you have a blood pressure cuff, you should take it and we should check to see what's going on, especially if you're noticing a severe headache, and you should notify your healthcare provider. Chest pain, right? Sometimes if we have anxiety, we do get a little bit of chest pain. So it's good to ask yourself in that moment, the symptoms I'm experiencing related to my emotional status. And if it's not, then chest pain is not normal. Okay. And again, these are things we want you to go to the emergency room for. Shortness of breath, right? We're no longer pregnant. We should be able to take a deep breath because we don't have a baby pressing up on our lungs. So if you are struggling to catch your breath, that is another reason we would want you to let us know. As well as if you're having swelling that's unilateral, right? Surgery, pregnancy, all of those are risk factors for a blood clot. So if you have one leg that is bigger than the other and it's painful to the touch, you need to go to the emergency room. Now, fever can be normal and what we're more kind of getting at is infection, right? And I always tell people when they're about to be discharged, there are 3 places that you can get an infection in our breast, right? So mastitis, painful breast, feels like you have the flu or you've been hit by a bus and you have a fever. That's something you need antibiotics for. You should let us know. You can get an infection in your incision. So pus is never normal. So if you notice pus, if you notice it's really firm, if it's really red, or you have drainage with that fever, please let us know. And we might need antibiotics in that situation. And then the last one is actually in your uterus. So that is, I have a fever. Maybe I have really bad smelling discharge, right? We know what is normal for us, what our discharge smells like. And if your discharge smells worse and you have pain that is not relieved by any pain medicine that we've given you, please let us know because it could be an infection in your uterus. And again, we need antibiotics for that. The last one we want to highlight is really important, and that's your mental health. If you feel like you are a danger to yourself or others, please let us know, right? We do know that being pregnant and early postpartum is a huge risk for mental health regressions. And we want to make sure you're getting help and that you're seeing the right people to get the care that you need. So feeling hopeless, panic attacks, feeling like you want to hurt yourself or others, please let us know in that situation because we want to make sure you get care.
Yeah, those are all really important notes for people to be aware of. So those are great nuggets. I think if anyone can walk away from this, episode today is that part. Okay. What is normal and what is not. But let's talk about something else, right? For example, imagine there's someone who's a 1 week postpartum and that person kept saying, I feel short of breath. My chest feels tight. My swelling is getting worse. But everyone around them is saying, oh, you're probably just anxious. You just had a baby. You're exhausted. And unfortunately, there is some postpartum danger that sometimes can be missed, just like, Kamisha just talked about. Because while anxiety is very common postpartum, shortness of breath, chest pain, those things can really represent some serious medical issues like preeclampsia that we discussed, postpartum cardiomyopathy, blood clots. And this is why listening to women matters. And this is especially true when we're talking about the Black maternal health conversations, because many Black women actually feel that they're dismissed, right? Especially when they express concerns like this. And then in that case, then that leads to some of the morbidity and mortality that we see. And a lot of these things happen actually not in the delivery room, but actually postpartum.
So now let's take a shift and let's talk about the emotional side of postpartum, which is significant, right? And a lot of this can happen as a result of sleep deprivation. That alone can change everything for a lot of women. When you're waking up every 2 hours for weeks, your brain and your body are under stress. Even simple tasks can feel overwhelming. This also can be a time that feels very isolating when you're up in the middle of the night and everybody else is asleep and you don't feel like you have someone to talk to. So then you layer on top of that your hormonal shifts, right? Estrogen and progesterone levels drop, as we've mentioned multiple times after delivery, and these hormones can contribute to crying spells, irritability, anxiety, emotional sensitivity. And for some women, that progresses into postpartum depression or postpartum anxiety. But one of the things we really want to make clear is that struggling emotionally postpartum does not make you a bad mom. One of the most common books that I will recommend to my patients is This Isn't What I Expected, which talks specifically about postpartum depression, and Good Moms Have Scary Thoughts, which talks about anxiety. So these are common things that people experience, and we want to normalize that for you.
Exactly. The other thing I'd like to get into now is really talking about relationship changes, right? And identity shift. That's something that I feel like women are rarely prepared for. With motherhood, with a new baby, that really kind of changes the dynamics of your household. It changes your identity. Sometimes you may not feel like yourself, or like, am I really someone's mother right now? Right. Even when motherhood is like deeply wanted and the child is deeply loved, it can still kind of feel disorienting. Right. And some women may actually have some guilt with admitting that. But let me just say that these transitions are normal. The other thing to note is that your relationship with your partner might actually shift. Suddenly, your conversations are not necessarily about just the two of you. They're now revolving around schedules. Intimacy can change. Sleep deprivation can make people more irritable and raise tension in the household. Responsibilities, delegation of tasks can increase, right? And a lot of couples actually underestimate how emotionally demanding this season, this period can be. So that's why communication is so important postpartum. I think it's a non negotiable. And it's not just about the baby, but also about each other, checking in regularly.
So let's just say this clearly for everyone, right? Postpartum is not just physical recovery. It's a complete life transformation. It's physically, mentally, emotionally, and relationally challenging, and women deserve support through all of it.
And so the big question now to kind of be raised is like, how do you move through postpartum more intentionally? The first one is to adjust expectations, right? This is not the season of I'm just going to bounce back. This is the season of healing, of adjustment, right? The second thing is building that support before delivery if possible, right? Because when you have a plan, it's easier to actually implement it in the moment rather than trying to just like, figure it out while it's all happening. And support does just not mean having visitors who want to come over and hold the baby, right? Real support actually looks like meal prep, you know, overnight help. I mean, that would really help with sleep. Someone cleaning, someone helping with lactation, getting therapy, and actual protected rest, because many women are trying to recover while also taking care of everyone else. And that's not sustainable.
At all. So we have a practical tool that we recommend trying, and it's called the Want Need Help chart. Because postpartum can make everything feel urgent, but not everything carries the same priority, right? So, what we want you to figure out is what are your needs, right? And you're going to identify that. It could be on a whiteboard or a piece of paper, something that's attached to the fridge so everybody can see. What are your needs? Are they hydration? Is it nutrition? Is it sleep? Is it showering, right? Is it brushing your teeth? Is it medication? Really identify that. What are your wants? You would like the house to be clean, right? You want to be able to entertain visitors. You want to look polished, maybe a little bit more put together. And what do you need help with? You need help with laundry, putting away, clothes, diaper changes, grocery runs, holding the baby while you go shower or sleep. And so this is an activity that you can do. And if you put it in an area when family or friends come over, they can say, how can I support you? And you can say, hey, can you check off one of the things on the help chart? Your partner can come home from work and say, hey, let me look at what your needs were. Did you shower? Did you drink water? Did you eat today? And that's a way that you can communicate with people without feeling uncomfortable about asking for the support that you need. Because sometimes the most important thing you can do postpartum is rest without guilt.
Yes. And the last thing I really want to hone in on is like paying attention to your mental health. So if sadness, anxiety, numbness, panic, feeling hopeless, or maybe it's rage or just feeling overwhelmed, if those things are worsening or lingering, it's so important to reach out for support. And please, please hear this. You do not have to wait until you're falling apart to feel like you deserve to have help, right? Early intervention matters. Therapy matters. Medications matter when they're needed as well. And community actually matters.
So I mean, in the end of the day, we just want people, all of our listeners, to understand that the postpartum period is often underestimated, right? But in reality, it's one of the biggest transitions a person can experience. That's why they truly created a fourth trimester for it, because we realized how significant it was. So recognize that your body's healing, that your hormones are shifting, that your identity is evolving, and all of that deserves care.
Yes. And if you find yourself asking, now what? The answer is now heal, right?
Mhm.
Now adjust, now ask for support. And you can stop expecting to do postpartum alone because we were not meant to do that ever. It was not
Mm-mm.
meant to be survived in isolation. It was meant to be done in community, in a nurturing environment, in a way that surrounds and cocoons you so that you're protected and so is your baby.
So we hope you found this episode helpful. And until next time, we'll see you later.